Hello everyone, my name is Madoka Sylvia, and today we'll be talking about one of my clients that is suffering from major depressive disorder. How did I know that SpongeBob is suffering from major depressive disorder? SpongeBob showed showed 5 symptoms from the newly approved DSM. DSM means Diagnostic and Statistical Manual of Mental Disorder. So SpongeBob, first of all, complained of not being able to make decisions on his own, not being able to concentrate and think. Secondly, SpongeBob complained of easily sliding into depressed moods. Thirdly, SpongeBob complained of not having strength to do anything, not his chores, not his homework. Fourthly, SpongeBob complained of always feeling unworthy and guilt over the slightest things. Then fifthly, SpongeBob complained of not being able to make decisions for himself, always not being able to think and concentrate. So now, how am I going to treat SpongeBob of this major depressive disorder? I'm going to choose one therapy from the psychodynamic therapy, then another therapy from the biomedical therapy. So from the biomedical therapy, I'm going to choose a drug therapy. And from the psychodynamic therapy, I'm going to choose the cognitive behavioral therapy. Why did I choose cognitive behavioral therapy? I love how it brings out your negative thoughts. And somehow, of course, when you see how negative you think, you'll want to change it to positivity. So I love how it twists your negative thoughts and makes them positive. Instead of you thinking negatively, you start thinking positively. That is simply what it does. So to start with, the techniques I'm going to use with SpongeBob is we're going to sit down and we'll both reveal what his beliefs are. Okay, we'll reveal his beliefs. We'll question his interpretation, how he interprets events, how he interprets things that happen around him. Then after that, we'll rank his thoughts. Rank these interpretations, rank these thoughts, and from the minimum to the maximum. Then after ranking these thoughts, we'll test his beliefs. We'll examine the consequences of his thoughts, what he thinks the consequences of his thoughts are. We'll examine them, then we'll decatastrophize them. We'll make him understand that all these things that he thinks are so major are actually not as bad as they seem. Then after decatastrophizing it, we'll change his belief. Changing his belief will make him take responsibility for things he can take responsibility for, and the things he can't take responsibility for, the things that he can't control, I'd rather use that word, he will let it be. Then after making him take responsibilities, we will then make him resist extremities, make him resist those thoughts that will make him crawl back into depression. So that is for the cognitive behavioral therapy. Then for the biomedical, which I chose the drug therapy, I'll make him take drugs that would increase his serotonin level, increase his serotonin and his norepinephrine, because people with depression usually have low serotonin and norepinephrine. So I'll give him drugs that would increase his serotonin and his norepinephrine. He's going to probably notice side effects. Some of the side effects of serotonin drugs are dry mouth, start feeling hypersensitive, then majorly dry mouth and being hypersensitive. But the advantages of serotonin is that it lightens your mood, it makes you happy, it makes people around you happy because you are happy. Then the cognitive behavioral therapy, the advantages is that it makes you channel your negative thoughts to positivity. Then the disadvantages is that while in the process you might feel depressed or you might cry a lot, and yeah, majorly that. So thank you.